My name's Kendal and I live in Emerald, Queensland. What I love about Emerald is nothing's more than 5 minutes away. There's a couple of good coffee shops too. We've lived here for 2.5 years. My husband Ben moved up with me, came up for a bit of lifestyle, spend a lot of time with family. It's cheaper to buy houses here.
Amazing grace. Kendal and I love singing together. It's something we've done since she was 5 years old. When Kendal and Ben decided to come back, on one hand I was excited. On the other hand, it was like I knew they were coming away from resources, you know, the doctors that she'd been seeing.
When I was 10, puberty hit like an actual ton of bricks. I just wasn't able to run anymore, and then I wasn't really able to be on my feet for much of the day. And I went until I was 20-something before I knew that that wasn't normal. I went and had a chat with the doctor and I said, look, I feel wrecked constantly. We were seeing all sorts of doctors and specialists. They diagnosed me with endometriosis and PCOS. The amount of paperwork that I had to print out, Forrest would weep.
Flights are so expensive. One specialist was visited and it cost about $850. That's just crippling.
It really wasn't until about 2.5 years ago that we got involved with fertility care, and NAPRO has realistically changed my life. It's the first system that's been able to put the dots together for me. I see my gynecologist, Dr. Luke. He's in Brisbane, but that really hasn't been an issue now that I've been using telehealth.
She feels that I'm part of her healthcare team. She can make a call to my rooms or to the public health here and just make an appointment. And we can make contact, and it saves her the 1,700-kilometre round trip. I love my health. I am able to link into my patients' telehealth wherever. It gives me an opportunity to travel the country. And in this last week, South Australia, I know they're about to pick their grapes if they can keep the cockatoos away and make sure the frosts don't come. A couple of weeks ago, they just finished shearing in central New South Wales. I'm there. I'm part of their care. I'm part of their family and their solution.
It has made a massive difference, being able to see him through telehealth. I mean, first of all, the money is massive. We would be spending so much money going down to Brisbane. And it's made him a lot more accessible. I have found him to be really the person that can help me the most with my health. And it wouldn't be possible to see him without being able to chat with him online.
One of the things I was concerned about with Kendal and Ben moving home is the fact that they were coming away from medical support. But I think this really has allowed them to come home and to live well here with us.
G'day, Kendal. How are you getting on?
Hey, good. How are you?
Really good, thanks. Telehealth is providing the opportunity for specialists to give health care to rural and remote Australians.
I don't know if I told you, but I'm actually just got accepted for that NAPRO course at the end of the year, the Fertility Awareness Program.
Oh, fantastic. That's amazing. Well done. Well, you're going to have your work cut out for you. Providing care for all those women remotely.
I will do.
Yeah.
Everything else in my life is digitally connected. Like, I've got social media, my banking's all online, and I'm so excited about being able to use my health record online. I can see my specialist through telehealth. I can access all my records in one place. It just makes sense. And not carting around heaps of paperwork is going to be great. And I'm so excited. Legit, I'm so excited.